Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you're new or if you are a regular viewer that has not yet subscribed, what are you all waiting for? Please do subscribe. You are going to be not only supporting me and supporting me making this content, but you're also going to be helping so many other people find this content, especially right now when we so badly need more educational, supportive, informative content. So please do subscribe. You're helping algorithm, you are helping so many others find it, and you're also helping me. So I would very much appreciate it. If you don't yet follow me on Instagram, also, what are you waiting for? I think this is a great time right now to support all of your allies. I'm definitely an ally for so many of you, and it would mean a world to me because I am trying to expand and grow community, and I would love to connect with you as well. Having said that, the last videos prior to this one did not have the best sound quality, and thank you so much for everybody who has shared that. Hopefully this video fixes it. Those of you who are very good at picking up sound variability, sound differences, please let me know if this is better. I think I figured out the gain on a microphone and moved it a little bit closer to myself without having it smack into my face to be able to get good sound quality. But please do let me know. This is the bane of my existence. I'm one woman show. I so much craving for a day when I'm gonna have somebody come in and just set up the audio and video for me and leave me alone so that I can spend most of my time on making this content for all of you. And so it's the amount of research that I have to do on this and then trying to figure all out is driving me nuts. So hopefully this fixes it, and moving forward we're gonna have good sound qualities. If not, I'm back to square one, and then I'll have to figure out, maybe get another microphone. I don't know how much better can it get, but we'll figure it out. So for today's video, this video is for very specific audience. I'm gonna lay out in the beginning a little bit of a little bit baseline who this video is for, so that way it can serve you the best. This video is for individuals who are assigned male at birth, who have a history of cross-dressing since early childhood, maybe age, most common people report 7, 8, 9, also puberty time periods, 11, 12, 13, and continued all the way into young adulthood and adulthood. And there is a connection to cross-dressing solely for sexual pleasure. You cross-dress, you get sexual arousal, you enjoy yourself, you orgasm. This video is for individuals who have that history, who are also wondering now in adulthood and trying to figure out, is it just cross-dressing, or is it possible that they are trans women? This is number one question people ask me. I have so many people reach out to me, and this is the number one question that is nagging at everybody's mind. So I just want to be very clear who this video is for. And if you are currently going through transition and you're a trans woman, it may be, still stay tuned, you might learn something, one. And two, another thing that is helpful about this video is that you will see how it's going to clarify some things for you, because there's also trans women who have sexual history of feminizing for sexual pleasure, but also I identify as trans women. I've done a lot of videos on different categorizations of this, different patterns. Today specifically, I will be focusing on individuals assigned male at birth who currently as adults do not report, currently as adults, and cannot stress this enough, do not report gender dysphoria, meaning you feel comfortable with your assigned gender. You feel comfortable being a man. You feel comfortable navigating your life as a man. You feel comfortable about your body. You have no physical dysphoria, you have no social dysphoria. You currently do not report any dysphoria whatsoever. But because you have engaged in cross-dressing for sexual pleasure from your childhood all the way up until now and still engage in this behavior, at some point in your engagement, it started to mess with your head, I don't know how else to put it, where you started to wonder and question how much of this is actually you being trans woman. And in fact, even now, you may be engaging in this behavior, wondering if you're trans woman, and there's a strong need to figure this out because there's starting to be a fear of regretting later down the line that you have not done something about it sooner. This is who this video is for. So I want to be super, super clear because there's a lot of overlap with a lot of other individual patterns. There's a lot of trans women who also have history of this behavior, but parallel to sexual preference of cross-dressing, also have innate transgender blueprint. There's also a lot of trans women who end up developing gender dysphoria. And I talked about it. It's completely, I have a video where I talked about it. Maybe I'll do a video just separate for each one of the categories. This is specifically for people who still cross-dress for sexual pleasure, report zero dysphoria again, no physical, no social, no dysphoria of any kind. Okay? And wondering, are you a trans woman? And I'm going to share with you one of the really good ways to figure this out. And again, for trans women who engaged in this behavior in early childhood or throughout to young adulthood, and who are now post-transition, mid-transition, considering transition, and wondering what was that all about, this is gonna help you also understand some things. For starters, I said this before, I'm gonna say this again, there's nothing wrong with having a sexual preference towards feminine objects, feminine items. Oftentimes, this cross-dressing as a sexual link. Oftentimes, it is linked to hyper feminine items of clothing. Pantyhose, panties, bralettes, lingerie, corsets, hyper feminine items. Individuals usually start early in childhood, and it continues to be as a form of sexual pleasure. It can continue to the point where you may have conditioned yourself and created such habituation and adaptability toward this particular type of stimulus that as young adults, it may become challenging to have intimacies with other partners because it's almost like you almost always have to fantasize about yourself wearing female clothing, or you need to be able to touch or feel the textile or female clothing. A lot of times, individuals will create a link. We'll create link to things that make us feel good. Just analyze your own current sexual preferences and when did that link start. So for individuals with cross-dressing as a sexual type of linkage, the link gets established at the moment when they first come across of it. They may have seen their mom's clothes or their sister's clothes. That's oftentimes how it happens. And just by looking at those items or touching them may lead to a sexual arousal. When we experience sexual arousal, we engage in repetition because it feels good, so we want to repeat the act. Okay? There is a lot of people, there's a lot of men, I'm going to say men because I am talking about individuals who are totally comfortable with their gender. A lot of men for whom this is their sexual preference. And it remains their sexual preference throughout their lifetime. There's a lot of individuals who will engage in cross-dressing for sexual pleasure and go on their daily day. They don't have gender envy, they don't experience dysphoria, they don't fantasize about being a woman, they don't daydream about transitioning. In other words, they're very comfortable and aligned with their gender. And this is who I'm making the video for. But at some point, it starts to become confusing. Because when you engage in a behavior in early childhood, all the way on throughout your development, in a behavior that is considered taboo, a behavior that you don't see normalized or oftentimes people don't talk about, you're going to start to question, it's kind of how it goes, you're going to start to develop questioning of why you're doing it and what is wrong with you. That will breed to cycle of shame and guilt. And there's a video where I do discuss that the cycle of shame and guilt prevents solidity of your innate gender identity as a guy, as a man, and creates an unstable core gender identity where, yes, people can then develop gender dysphoria and then do start to identify strongly with trans female identity and do transition. This is how one can develop a transgender identity, right? Versus people who are born and from childhood onset, they just feel incongruency. We're just innate in them. I talked about it again in other videos, and perhaps if you're interested, let me know. I'll make another video about it because it's such a, it's very, it is very complex subject matter. Sexual linkage to feminization and transgender identity. I also need to make a video about forced feminization fantasies and specifically being attracted to forced feminization fantasies versus just feminizing you yourself, feminizing yourself. It's not simple as black and white. And it's definitely not the way Ray Blanchard, in my opinion, laid out after gynephilia theory. I have also a video on that with all of the points of what I disagree about his theory and how it's laid out. But sexuality, sexual preference specifically to either female clothing or perception of yourself as a woman that feels arousing to you definitely has an effect potentially on creating transgender identity or not. And people just have that as sexual preference for the rest of their life. And again, I'm going to make it very super clear. And by far, a huge portion of individuals who are trans-identified have experienced that incongruency from the first time, 4 or 5 years old, when they could understand gender differences. So I just want to make it clear that the sexual link is not there for everybody. That's very important to stress out here, okay? Very, very important. Very, very important. So, because you start questioning things about yourself, now as adults, again, you're still not reporting gender dysphoria history. You still feel very comfortable with your assigned gender. But now, we live in a world where everybody talks about transgender. Not only that, anytime you try to figure out and learn more about your cross-dressing sexual behavior, there is a gazillion of misinformation on the internet. What's the word I'm looking for? Colluding comes to mind, but yeah, it's there's tons of information on the internet that is not accurate, that correlates. That's the word, correlates. Oh, if you cross-dress for sexual pleasure, you're definitely a closeted trans woman, which is not true. And it is not always the case. So you can see how for somebody who's trying to figure out, why have I had this sexual preference in childhood? What could it be telling me about now as adults? It could be hecka confusing. So tip number 1, before I give you one of the the best way to figure this out. Tip number 1, Again, square one, always square one. Are you experiencing any incongruency with your assigned gender? Any discomfort being a man? Any discomfort being third? Any discomfort about your physicality? Any discomfort navigating this life as a man? In my experience, people for whom sexual cross-dressing is just that and continues throughout their entire life report zero incongruency. Zero. There might be attributes they don't like about themselves as a man. We all have attributes we don't like about ourselves. But they're just more confidence kind of felt attributes versus having a strong sense of not feeling aligned with your gender. So that's number one tip. Always go back to square one. Forget what you hear out there that if you cross-dress for sexual pleasure, you're definitely a trans woman. Forget all of that. Ask yourself, how do you feel about your gender? If you again don't have any dysphoria, physical, social, or otherwise, and you feel comfortable about your assigned gender, then chances are you're cross-dressing because it feels good, because it is sexually tied for you, it's a sexual preference. That's number one way to look at it. The second tip of how to figure out if this is just sexual cross-dressing or something else is, throughout your lifetime, is there any changes to this behavior? Meaning, have you found yourself suddenly cross-dressing no longer for sexual pleasure, but because you feel more connected to yourself, but because you feel more at peace with yourself, because you find something about being in feminine clothing that makes you feel more authentic? If the answer is yes, explore this. This could be, careful with wording here. I don't want any of you to have bells and whistles go off in your head. This could be an indicator that you may have had trans history all along, trans blueprint, or it could be an indicator that you have developed a transgender identity. Again, a lot of our identities, especially related to gender, are not fixed. Just like sexuality is not fixed. We know this. How do we know this? Because people throughout their lifetime change their sexualities. They shift. Why do they shift? Because for human beings, our experiences and what we experience inform our sense of self. Okay, for various reasons. Just becoming more aware, more knowledgeable will undoubtedly inform things about ourselves. Okay? I personally have an opinion, this is just my opinion, that pretty much everybody is really more bisexual than they than to believe, and we've been culturally kind of conditioned for heteronormative sexual behavior. Gender is very much the same thing. I think a lot of us are actually way more fluid in our gender identities than being very polarizing, black and white. So lots of things can shift. If you again finding yourself that you're cross-dressing and now it's not driven by sexual drive, it is just driven because you feel more authentic, you feel more at peace with yourself, you feel more comfortable. It takes the edge off. If it takes an edge off for what? Those are all important questions to ask and explore for you. And the third tip. Now this tip does involve, for adults, stepping into feminizing hormones for at least a month or two. And this is not a very viable suggestion for individuals who are not considering transition at all. This is more for individuals who are, again, you don't experience dysphoria, but you genuinely do think that you also might be a trans woman, even though you don't experience dysphoria. But wondering how much of what you experience is tied to sexual arousal. Why feminizing hormones? Well, feminizing hormones for a lot of people will at least to some extent reduce sexual drive, sexual libido. Because we're talking about cross-dressing as a sexual linkage, when the sexual drive is decreased, that's a very important telling point. Okay, what is it then telling us? I have clients that I've worked with who went and tried feminizing hormones for even a couple of weeks, and for them, their sex drive reduced. They had zero desire to feminize, to cross-dress. They desire to wear feminine clothing and items completely vanished for them. Completely vanished for them. So that was very, very telling, right? That was very, very telling. And it was also very telling because during that time period, again, asking those questions, how do you feel about your assigned gender? Do you see yourself as trans woman? And those people would answer, no, I don't see myself as a trans woman. But now the sexual linkage is gone. I have no need, no desire for those feminine items. This is why I said for trans women who are transitioning who may have cross-dressed for sexual pleasure to watch this video, because a lot of you know, those of you who also have innate blueprint of trans identity, you know that it may have been tied a little bit to sexual arousal, but once you went on hormones and your sexual arousal went down and the desire to feminize for sexual pleasure vanished, you still wanted to identify and be seen and navigate this life as a woman. Do you see the key difference? You still had dysphoria. In the very least, you still felt not aligned with your assigned gender. You still felt discomfort being a man. This is a big difference. This is how one knows that it's not just sexual linkage or just sexual behavior. That innate desires, not even desire is not the wrong word, right? Because desire makes it sound like it is something you choose to experience. That innate need, that's better. That's innate need. That innate authentic truth, the connection that you are a woman, should remain with you in spite of sexual drive going down. In spite of, now that when I feminize, I no longer get an erection and want to masturbate. Now it just feels really good. It just feels more like myself. That's also telling. That's telling you that, yeah, you had that blueprint of a woman's identity all along. And sexual preference, sexual connotation could be just a part of it for numerous reasons, not to mention how much pornography affects for men and boys growing up, affects visual stimulus that leads to physiological response, aka erection. Okay? So this is very, very telling for individuals who are questioning to such a big extent they're considering transition. Like, okay, well, let's give feminizing hormones a month or two. There's not going to be any big drastic physical changes. Let's see what's going to happen when your sexual drive goes down. Do you still want to transition? Do you still want to identify as a woman? If the answer is no, and it's a strong no, and there's still no dysphoria, and you still feel comfortable with your assigned male gender, then there's a high chance all it is the sexual behavior that you enjoy engaging in. And my advice, not to overthink it. I feel like today everybody's overthinking everything, overthinking, trans identity. And yes, gender identity is complex, but the underlying root of gender identity, the underlying root is discomfort with assigned gender. Yes, I know people are going to tell me that some people don't feel discomfort with their assigned gender, but they just find out that they feel even more comfortable with the other gender. Okay, that's fine. But remember, I specialize in gender dysphoria. Gender dysphoria is a distress signal. It's a distress signal that our bodies give out when things got so far of disalignment with ourselves. And by specializing in gender dysphoria, I know and I've seen that the root cause to specifically transgender identities that are part of yourself are tied to disalignment. So it's really important not to overthink it. Again, if you are feminizing and you cross-dressing and you feel so good wearing pantyhose or wearing panties, and it's part of your sexual landscape, and you love it and you enjoy it, whether you do it by yourself or with a partner or partners, and then once it's done and over with, you feel totally fine about your assigned gender, then that's all there is to it. Hormones is the very last result for any additional clarity because it helps with, sexual drive going down. Alternatively, to flip that, I just had a realization. Alternatively, another way is without the hormones. On the days, during the times when you're not having sexual drive, when your libido is not high, when you don't have a desire for sex, either self-pleasing sex or sex with anybody else. Let's say you're sick, right? Oftentimes when we're sick, our sex drive goes down because for a lot of people, the hormone levels gets quite depleted. So let's say you're sick, you're not feeling well, and your sex libido is down. Be inquisitive about yourself. Do you have any desire to feminize during those days? And if you do, what is it telling you? Everything has a tell. Everything has an intel. Everything has a piece and shred of information. So it's really, really important to pay attention to all of those things. So hopefully this is helpful and hopefully the sound is good. Oh my God. You have no idea how painful it is to be able to record a lot of content and pour your heart into the content and not have the best sound quality. It kills me. So this is again for those of you who don't have dysphoria, assigned male at birth, comfortable with your gender, cross-dress for sexual pleasure, and wondering if you're trans. Okay? These are some of the things to pay attention to. The number of individuals I have reaching out to me with this question are numerous. And for those of you who also are trans and have had sexual arousal when you were feminizing, you also, it's been very telling for you, because when your sex drive went down, you still wanted to transition because you deep down identify as women. Comment below, share your experiences, share what you're struggling with. Let me know if you want me to do other segment videos where I talk about how, for example, an individual can develop gender dysphoria and can develop trans identity from sexual cross-dressing behavior, and a lot of other videos in the same kind of context. I know that it's an important topic because, one, it's important to normalize cross-dressing as a sexual behavior for so many males who don't have gender dysphoria, and to understand that, this is the behaviors that if it's pleasurable to you, by all means engage in it, and it doesn't always means you are transgender, because there's, again, as I said, so much misinformation on the internet. So comment below, share, feel free to share what other topics you would like to hear me make videos on. Hope you have a wonderful day, and I will see you all in next video. Goodbye.